Today we are going to demonstrate the neurological examination for you. It will take about 10 to 15 minutes for a thorough evaluation. Here are the instruments we are going to use for this purpose. For the eye examination, a flashlight, also an ophthalmoscope, a Snellen's chart or an eye chart, a reflex hammer for deep tendon reflexes, a tuning fork, 128 Hertz for sensory examination, a tongue blade for gag reflex, and a pin for sensory examination. There are 5 parts of the neurological examination. The first part is the mental status examination, which tests mentation and cognition. So I'm going to ask a few basic questions. What is your name?
Hang.
Where are you right now?
I'm at USC in Los Angeles, California.
What is the date, day, month, and year?
Today is Tuesday, July 7th, 2015.
And this is to test if a person is alert, oriented to time, place, and person. So the second part of the neurological examination is cranial nerve examination. There are 12 cranial nerves on the head and neck, and here is a picture demonstrating them. We will start with testing cranial nerve 1, which is the nerve for olfaction, and we will test it with a strong odor. Hang, go ahead and close your eyes and cover one nostril. Do you smell something?
Coffee.
Now cover the other nostril. What do you smell?
Coffee.
Great, thank you. Open your eyes. Now we are going to test cranial nerve 2, which is the nerve for vision. And we are going to use a flashlight to look at the pupillary reflex. And that is called a swing and flash test. So look straight for me, Hang. And we're going to look at how the pupil responds, what is the size of the pupil, and the direct response as well as the indirect response. So the direct response is when the pupil is looked at with a flashing light to see if it constricts, and the indirect response is to look at the left pupil when the light is away from the left pupil. Then going on to the right pupil. The second part of the eye exam is the ophthalmoscopic examination. And for the ophthalmoscopic examination, we use an instrument called the ophthalmoscope to look into your eye. Look straight for me, and we're going to look into your eye. We did the right eye, and then we will do the left eye. The third part of the eye examination is the vision test, and we are going to use the eye chart. Go ahead and hold the eye chart at arm's length and read the words from the top.
958742843.
Read the last line for me now.
428739.
Thank you. And that is 20/20 vision. The last part of the neurological examination of the second nerve of the eye is the visual field test. And for that, I'm going to have you cover your right eye. And I'm going to step forward and ask you to see if my fingers are moving. Do you see my fingers move?
Yes.
How about now?
Yes.
Cover the other eye for me. Do you see my fingers move?
Yes.
And how about now?
Yes.
Thank you. So that concludes the cranial nerve second examination. The next 3 nerves we are going to test together are cranial nerve 3, 4, and 6. And they are for testing the visual movements, so the eye movements. I'm going to have you look at my finger and follow my finger without moving your head. Look towards the left, and you see one everywhere.
Yes.
And look up and down. And during this time, we're also observing for any nystagmus or any other abnormal eye movements. So this is testing cranial nerve 3, 4, and 6. To test cranial nerve 5, which is responsible for sensations of the face, we're going to use a pin now. Have you close your eyes, and I'm going to use a pin on your left forehead. Tell me if you feel it.
Yes.
Both sides
Yes.
equally. Yes.
Yes.
And that is testing cranial nerve
Yes.
5. Moving on to cranial nerve 7, which is the nerve for facial muscles. I'm going to have you do certain tasks. Please raise your forehead, close your eyes really tight, and don't let me open your eyelid. Now open your eyes and puff your right cheek, and now your left, and pucker your mouth. And that is cranial nerve 7. For cranial nerve 8, which is the nerve for hearing, I'm going to have you close your eyes again and tell me if you hear a sound on your right ear.
Yes.
How about on your left ear?
Yes.
Go ahead and open your eyes now. Cranial nerve 9 and 10 are responsible for the gag reflex, and we're going to use a tongue depressor to test the gag reflex. During this time, we are also going to test the 12th cranial nerve, which is the nerve for the tongue, the glossopharyngeal nerve. So go ahead and open your mouth, and I'm going to put the tongue plate down. Say ah, and I'm looking at the palate and the uvula, and thank you. Now open your mouth again, and we are looking at the tongue now to see if there is any atrophy, and look at the movements. So left and right, and say ah, and stick it out straight, and put it back in. So we looked for abnormalities of the tongue, and also at the gag reflex and the uvula and the soft palate. Now we're left with cranial nerve 11, and that we're going to test two muscles. The first one is the sternocleidomastoid muscle right here. So to test the right sternocleidomastoid, I'm going to have you push my hand towards the left, and here is the muscle that is activated, and relax. Now to test the left sternocleidomastoid, I'm going to have you move your jaw towards the right, and here is the muscle that is activated, and relax. And to test the second part of the nerve, that is accessory nerve, I'm going to have you shrug your shoulder up, and that is the trapezius. And for the other side on the right, up, and that is twisting the trapezius. And that concludes the cranial nerve examination. So now we are going to do the third part of the neurological examination, which is the motor examination, to test all the muscles. And we will start with the simple basic principles of looking, inspecting and palpating. So we're going to look for atrophy and palpate the muscles for any tenderness or pain. And then we're going to test the tone. So we start by asking you to relax, and I'm going to move the muscle around in an imaginary circle and look for any resistance at the elbow, and then again at the wrist. Similarly with the left hand around the elbow, and then move the hand in an imaginary circle to look for resistance. I'm checking tone. For the legs, relax your leg, move the leg around, and the ankle, make imaginary circles to test for muscle tone. And again on the left side, move the leg around and checking the tone on the ankle. Once we have finished that, we can check for pronator drift. Lift your arms up, turn them over, and close your eyes. And this is normal. What we are looking for in an abnormal situation is a pronation and a downward drift of the right arm if it is weak. Go ahead and open your eyes now. So moving on to individual muscle testing, we're going to start on the shoulders. Lift your arms up, and we will do each range of motion at the shoulder. So lift your arms up and resist me, that's abduction, and push down, adduction, and push your hands like this and towards yourself, flexion, and push down, extension, up, flexion, and down, extension. Now at the elbow, pull towards yourself and push. Now at the wrist, push your hand down like this, put your hand this way, and wrist up and wrist down. Okay? Now both hands like this, and we're going to look for small muscles of the hand, strength. Keep your fingers tight, keep them open and tight. And don't let me resist. And so we're testing the small muscles of the hand. Now turn your hands over and curl your fingers in slightly and looking for finger flexors, strength. And don't let me resist. Close and relax. Put your hands down. Now we're going to move on to testing the legs. We will start at the hip joint and we will test all the ranges of motion at the hip joint, starting with flexion. Go ahead and raise your leg up, resist me, and this one. And now together, this adduction, out, abduction, push as hard as you can. Now lift your leg up and push down, that's extension, up and push down, that's extension. Now straighten your leg and resist me, that's knee extension, and push in, relax, up and down. So we did 2 ranges of motion on the knee. Now go ahead and raise your right leg up again and toes up, resist me, dorsiflexion, toes down, resist me, plantar flexion, inwards, that is inversion, push as hard as you can, and out is eversion, and relax. We can do the same thing on the other leg. Moving on to the deep tendon reflexes, we use a reflex hammer for that purpose, and place yourself right across from the patient and test the jaw jerk. Open your jaw slightly and relax, and I press the hammer against his jaw and relax. Let's test the other reflexes. So the technique to doing a reflex examination is to use the hammer with the wrist as a fulcrum and make a large circle, semicircle rather, and then drop your hammer firmly onto the tendon. So the first tendon we are going to test is the brachioradialis. Find the tendon and hit with your reflex hammer and look at the muscle for reaction. The next one is the biceps tendon, which is easier to find, and you can find the tendon and hit it with the reflex hammer. And you feel the response and you see it. The triceps tendon is on the back right here, and you can test it by feeling it first and hit it with the hammer. The other technique to do it is to raise the arm, hang it loose, find the tendon and hit it, and you see the reflex response of the triceps muscle. And thank you. We're going to test the knee jerk now, and for that you can feel the quadriceps tendon and also see it. Find the tendon and hit it with a hammer, and you see the knee jerk. Now for the ankle jerk, hit the tendoachilles with the hammer and you will see the response. And so we can do the same thing on the other side. Biceps, brachioradialis, triceps, the left knee jerk, and the left ankle. Now the last test we're going to do is the Binsky response. For that, I use the thumb on the lateral aspect of the foot to apply some pressure and look at the big toe, whether it's going up or down. So apply pressure on the lateral aspect of the foot with your thumb and see if the big toe moves up or down. Downward movement is normal and upward movement is abnormal. And you can do it on the other side as such, and just look at the movement of the big toe. And that concludes the motor examination. So the fourth part of the neurological examination is the examination of the sensory nervous system, and there's a picture of it illustrated here. And that will test two pathways, the light touch, pinprick, and temperature, and the posterior column, which is the vibration and proprioception. So we will start with just light touch and pinprick. So close your eyes for me, and you can feel me touching you both sides equally, everywhere, yes?
Yes.
And I'm going to touch your legs here, yes?
Yes.
Now I'm going to use a pin on your left cheek. And do you feel a pin? Yes?
Yes.
And here,
Yes.
do you feel a pin on your arms?
Yes.
And on your legs?
Yes.
And we can use the back of a tuning fork to test temperature. Do you feel something cold on your left forehead?
Yes.
It's a bit cold here. Yes?
Yes.
And on your hands
Yes.
and your legs.
Yes.
So next we are going to test your vibration sensation, and I'm going to use a tuning fork. Close your eyes and tell me if you feel a
Yeah.
vibration on your hand.
Yes.
How about on your knee?
Yes.
And do you feel it on your toe?
Yes.
Okay, let's do it on the other side. Do you
Yeah.
feel a vibration?
Yes.
And yes?
Yes.
How about now?
Yes.
And you can open your eyes. So if the patient does not feel the vibration or has stopped feeling the vibration on his foot, but you can still feel it, then test it again on the patient's hand. And if he can still feel it and you can still feel it, then that sensation is abnormal and it may indicate a neuropathy. Moving on to proprioception. Go ahead and close your eyes. And I'm going to move your thumb up and down, and you will tell me which way it's going. So tell me.
Up. Down. Down.
Okay. Now let's do the same thing with the big toe. Tell me which way it is going.
Up. Down. Down. Up.
Excellent. And we can do it in the same manner on the left side. Thank you. The last part of the neurological, or the fifth part of the neurological examination, is testing coordination and gait. I'm going to go ahead and test coordination. Go ahead and lift your right hand and touch my finger. Touch your nose. Do it again. And one more time. Let's do it with the left hand now. Touch my finger. And one more time. And relax. Now go ahead and move your right heel on your left shin. Up and down as precisely as you can. Thank you. And let's do it on the left side. Heel to shin. And that's good. Thank you. Now I want you to stand up and put your feet together and close your eyes. Go ahead and walk normally for me up to the end of the hall here and turn and walk back. During this time, I'm observing his arm swing, his turning, and other aspects of his gait. Thank you, Heng, and this concludes our neurological examination. Thank you all.